Nearly 70,000 West Virginians could lose their healthcare coverage in just a few months, and the political finger-pointing has already begun. Here's the reality, hitting the Mountain State hard. Those pandemic-era tax credits that have been keeping healthcare affordable for thousands of families, they're about to vanish at the stroke of midnight on December 31st, potentially triggering what many are calling a healthcare catastrophe. To understand why this matters so much, let's step back 15 years. The Affordable Care Act, also known as Obamacare, completely transformed how Americans access health insurance. Think of it as creating a giant marketplace where people who don't get insurance through their jobs can shop for coverage. Kind of like comparing car insurance online, but for your health. But here's where it gets controversial. West Virginia already holds the unfortunate distinction of having the nation's highest marketplace premiums. Without those federal subsidies acting as a financial cushion, families could see their monthly healthcare costs explode by an average of 133%. That's an extra $1,400 per year that many simply cannot afford. Delegate Mike Pushkin, a Democrat from Kanawha County, isn't mincing words about who he blames for this brewing crisis. By failing to extend these tax credits in the president's bill, they put just in West Virginia nearly 70,000 people at risk of losing their health care, Pushkin declared, clearly frustrated with what he sees as political inaction. And this is the part most people miss. The ripple effects go far beyond just losing insurance. Health policy analyst Rhonda Rogambi paints a stark picture of what happens when healthcare becomes unaffordable. Healthcare will become much more expensive across the country, she explains. We are looking at an average increase of 133%, or $1,400 on average, and the estimates that we've seen show that we expect to lose 15,000 West Virginians from the program simply because they can no longer afford it. But here's where the political battle lines are drawn most sharply. Pushkin doesn't hold back when criticizing state leadership, targeting both the Republican supermajority in the legislature and Governor Morrisey. I don't see a lot of willingness from the Republican supermajority or Governor Morrisey to do anything at all about it, he said bluntly. It's going to be a real problem for states like West Virginia. Yet not everyone is ready to wave the white flag. Rogambi maintains a cautiously optimistic outlook, citing behind-the-scenes conversations in Washington that suggest help might be coming. We're hearing whispers from Congress, including Senator Shelley Moore Capito, that the Senate is considering finding ways to extend these tax credits ahead of open enrollment on November 1st, she revealed. But here's the harsh reality that keeps healthcare advocates awake at night. When families are forced to choose between medical coverage and basic necessities, healthcare almost always loses. Rogambi captures this heartbreaking dilemma perfectly. When we limit access to healthcare that is affordable and accessible, many people will drop that so that they can keep other services, like keeping a roof over their head, keeping food, and keeping their children's mouths fed. To put this in perspective for those unfamiliar with how these tax credits work, imagine you're shopping for health insurance and the monthly premium is $500. The government tax credit might reduce that to $150, making it actually affordable for working families. When those credits disappear, you're suddenly facing that full $500 monthly payment. An impossible leap for many West Virginia households already struggling with the state's economic challenges. The timing couldn't be worse, with open enrollment for 2026 health plans beginning on November 1st. Families across West Virginia will be making crucial decisions about their healthcare coverage, while lawmakers in Washington continue to debate whether these lifeline subsidies deserve extension. So here's the million-dollar question that's sparking heated debates in living rooms and legislative chambers across the state. Is healthcare a fundamental right that government should help make affordable, or should market forces determine who gets coverage and who goes without? What do you think? Should Congress prioritize extending these healthcare subsidies? Or are there better ways to address West Virginia's healthcare affordability crisis? And perhaps more controversially, when politicians fail to act on issues that directly impact thousands of families, who should voters hold accountable come election time?